Dear friends, have you ever experienced an itch that just wouldn't go away? No allergy, no rash, no visible cause, yet it lingers day after day. Many people over 50 think it's just dry skin, but in reality, it could be an early warning sign of something much more serious, like liver cancer, blood cancer, or lymphoma. I once met a farmer who had a strange itch on one leg for weeks. He ignored it until sudden weight loss pushed him to get tested, and doctors found early-stage lymphoma. He said, "If it weren't for that itch, I never would have gone to the hospital." And that's exactly why today, I want to share with you 6 spots where persistent itching often gets overlooked. But in reality, they may be subtle warning signs your body is desperately trying to send you. Please stay with me until the end of the video to understand clearly, why does it itch in that exact spot? How do we tell the difference between a harmless itch and a sign of something serious? And when should we go see a doctor to avoid missing that golden window for diagnosis? If you find this content worth reflecting on, please leave a comment with 1 if it was helpful, or 0 if it didn't quite meet your expectations, so I can keep improving future videos. And if you haven't subscribed to the channel yet, click that subscribe button and turn on the notification bell, not just to stay updated with new videos, but more importantly, so you won't miss any silent warning signs your body might be sending. Now, let's get started. The first area I want to talk about is persistent itching in the lower legs, especially in the front of the shins. Sometimes it comes with a tingling sensation, or it feels like tiny ant bites, even though the skin looks completely normal. No redness, no flaking, and no signs of typical eczema. Have you ever experienced this? Especially at night, the itch becomes more noticeable. The more you scratch, the worse it feels, and scratching brings no relief. Sometimes it even causes insomnia as the itch keeps coming back repeatedly. In medical terms, this is referred to as a sign of chronic peripheral nerve irritation, and more notably, it's been documented as an early signal of lymphoma in many elderly patients. When cancerous cells begin to grow in the lymphatic system, the body reacts by releasing inflammatory mediators. These substances not only disrupt immune function, but also affect peripheral nerves, triggering a persistent itching sensation, even when the skin itself appears undamaged. 2. Itching in the upper back, a possible warning sign from the liver. You know, there's one itchy spot that seems harmless, but is closely linked to the liver, and that's the upper back, right between the shoulder blades. If you feel a deep, dull itch in that area, no rash, no bumps, and the more you scratch, the more it burns, don't take it lightly. Especially if it lasts for days, and even anti-itch creams don't help. This might be a signal from the liver, your body's most important detox organ, that it's under stress without you even realizing it. Liver specialists explain that when the liver is inflamed, scarred, or possibly developing tumors, bile won't be processed and expelled properly. As a result, bile salts and toxins accumulate in the bloodstream, circulate throughout the body, and stimulate the nerve endings under the skin, causing itching without any visible skin reaction. Interestingly, the upper back, where many large nerve branches converge, is one of the most commonly affected areas. I once met an older woman, in her 60s, a market vendor. She said for months she had an itchy sensation in just one spot on her upper back, a tingling type of itch, but no rash. She tried changing soap, switching bras, even using different laundry detergents and anti-itch creams, but nothing worked. At first, she thought maybe it was due to liver heat from eating too much fried food. But then she started to lose appetite, felt exhausted, her urine darkened, and her nails turned slightly yellow. That's when she finally went for a liver test. The results showed her liver enzymes were abnormally high, and further scans revealed a small tumor in her liver, thankfully still in its early stage. Without that persistent back itch, she said she probably wouldn't have gone for a checkup. Her story is a valuable warning that I wanted to pass on to you today. Itching on the scalp and back of the neck, possible sign of lymphoma. Persistent itching on the scalp and back of the neck, with no dandruff, no psoriasis, and more intense at night, along with small lumps behind the ears or under the jaw. This is a common early warning sign in patients with lymphoma. A 65-year-old man I met once thought it was just an allergy to shampoo, until the itch spread down to his neck and lymph nodes appeared. After a medical exam and biopsy, he was diagnosed with early-stage Hodgkin's lymphoma. If you experience prolonged itching around the head and neck area, accompanied by weight loss, night sweats, mild fever, and painless swollen lymph nodes, please go for a hematology specialist checkup as soon as possible. Itching around the chest, warning sign of breast cancer. In women over 50, persistent itching around the nipple area, dry, flaky skin, and mild burning, even without swelling or redness, should raise concern for Paget's disease of the breast. This type doesn't usually form a large lump, but instead shows symptoms like itching, crusting, and nipple retraction. I once met a 58-year-old teacher who had persistent itching around her left nipple. Creams didn't help, and it wasn't until the skin became slightly rough that she finally went for a checkup and was diagnosed with early-stage Paget's breast cancer. Ladies, and even men, if you notice prolonged itching, skin changes around the nipple pulling inward, or unusual discharge, go for an ultrasound or mammogram right away. Itching in the palms, sign of blood cancer. An itch deep inside the palms, without rash or peeling skin, along with easy bruising, frequent nosebleeds, and unexplained fatigue. This could be a sign of leukemia, blood cancer. One viewer once shared with me that they experienced an inner itch in their palms that just got more irritating the more they scratched, along with frequent nosebleeds and sudden weight loss. A blood test later showed abnormally high white blood cell counts. If you're noticing any of these symptoms, it's important to get a full blood panel done to check your red blood cells, white blood cells, and platelets so you can catch potential issues early. Itching around the anus or private areas, possible cancer warning. Itching around the anus or private areas that lasts for weeks, not caused by allergies or hemorrhoids, and not accompanied by rash, and doesn't improve with creams, can be a subtle but serious warning sign. Many patients with early-stage anal or vulvar cancer only experience prolonged, painless itching for weeks, without bleeding. I knew a 70-year-old man who had itching around his anus for 3 months. A colonoscopy revealed a small tumor, early-stage cancer. Postmenopausal women often overlook itching in their private areas, thinking it's just hormonal, but it could actually be vulvar cancer. Don't let embarrassment delay a checkup. Protecting your health is never something to be ashamed of. Dear friends, throughout this video, we've walked through 6 areas of the body where what seems like a simple itch might actually be a serious warning from within. From the lower legs, upper back, scalp, chest, palms, to the anal and genital areas, each lingering, unexplained itch might be the first knock from a serious disease, even cancer. And most importantly, it's not about making you afraid. It's about learning to listen, to question, and to act at the right time. No one wants to be sick, but if there's even a chance to detect it early, just from a persistent itch, then we shouldn't ignore it. Because not all warnings are loud. Sometimes it's just an itch that won't go away, a strange tingling, or a quiet discomfort we can't scratch. And if we take a moment to truly pay attention, that could be the very thing that saves our life, our health, and peace for our loved ones. If you found this video helpful, please leave a comment saying, "I will pay more attention to my body," as a reminder for yourself, and as encouragement for others who may be quietly struggling without knowing why. And if you haven't yet subscribed to Chân Lý Sống, click that subscribe button, not just to follow new videos, but to make sure you never miss an important signal your body may be trying to send you. Because sometimes a small itch can save an entire life, if we care enough to love ourselves.